Welcome to Season 2 of Healing the Tigress, a podcast of conversations and stories on Asian American Pacific Islander maternal mental health. We are your hosts, Peggy, a perinatal mental health therapist,
and Jasmine, a clinical pharmacist who is perinatal mental health certified. As Taiwanese American mothers who lived through postpartum depression and anxiety, we felt like we didn't hear about other AAPI mothers struggling with their mental health in new motherhood. But we knew it couldn't just be us.
So we created this podcast because we hope that sharing these stories can start to break the stigma of mental health in our community and help heal the inner tigress in all AAPI parents. Welcome back to Healing the Tigress. Every year during the month of October, we honor Pregnancy and Infant Loss Awareness Month. Oftentimes, the grief experienced by parents after a pregnancy or infant loss is called disenfranchised grief, where it is often overlooked or minimized by society because sometimes people do not get to see who we are grieving. Before we begin our episode today, we want to offer a trigger warning that we will be discussing pregnancy loss, which may be distressing for some listeners. You're welcome to stop here if you think it may be triggering for you and return at a later time to listen if you wish.
About 10 to 20% of pregnancies end in miscarriage, which is the loss of a baby before 20 weeks. About 1 in 100 of pregnancies will end in a stillbirth, which is the loss of a baby after 20 weeks. In the U.S., a majority of pregnancies where a major congenital fetal abnormality is detected end in TFMR, or termination for medical reasons. Depending on the severity, the percentage can range anywhere from 70 to 95%.
So, to honor the grief and loss of many people who have lost babies, we wanted to share the story of our next guest, Eileen Santos Rosete. Eileen holds a Master of Science in Marriage and Family Therapy, is certified as a DONA International postpartum doula, trauma-informed yoga teacher, and grief educator.
Her brand, Our Sacred Woman, is known for its elevated offerings that help women feel seen, held, and honored. Her debut book is titled To Tend and to Hold, Honoring Our Bodies, Our Needs, and Our Grief Through Pregnancy and Infant Loss. So to kick us off, I'm going to actually let Eileen do a short reading from her book before we dive into our questions. Eileen?
A moment of silence. Before we begin, I invite you to pause for a moment of silence to honor yourself and your experience of womb loss, for they are deserving of such a moment. If it feels resonant, place one or both hands over your heart and either soften your gaze or close your eyes. Allow the silence to last as long as you need it to. Maybe for just a few breaths, maybe for a few minutes. And as you take this moment to be in silence, you might consider all who are listening and doing so alongside you. You are not alone in your pain. When you are ready, allow your breath to help return you to the present, slowly opening your eyes if they are closed. And it is with this spirit of reverence that we begin.
Eileen, thank you so much for being here today to share your story with us. And usually before we get started, though, we do ask our guests if they could briefly share with us your cultural heritage and your background, and maybe a little bit about your journey in motherhood. I know we have a lot to talk about today.
Yes, thank you both for having me here. It is an honor. I've been an avid listener. My background, ethnically, I am Filipino American. My parents immigrated here in 1980. I was born in the Chicagoland area and then raised in Southern California. As you mentioned in the intro, my background is in marriage and family therapy. I'm also a postpartum doula, grief educator, and trauma-informed yoga instructor. And I've brought all these different parts of me to the present in my work now as a postpartum doula, really bringing in a grief and also trauma informed lens into all I do. And that very much is present in the book.
Thank you so much. And you share with us that you have three living children right now, correct?
Mm-hmm.
But that you also have some angel babies. So, can you share a little bit more with us? Maybe what that journey was like, or give us a timeline, I guess.
Sure. My partner and I began trying to grow a family in 2014, and the first pregnancy went very smoothly. We conceived on the first try. The pregnancy was smooth, and I felt very supported. We were living in downtown Chicago at the time, and my chiropractor, my Webster trained prenatal chiropractor, was just downstairs in our building. I saw her once a week. I got massage at that practice as well. I got 90-minute massage every week. I saw my acupuncturist every week. It was amazing. And I felt very supported by the midwives I was with, and I gave birth in July of 2015. And then about a year later, a little over a year later, I found out I was pregnant, and it was more or less unplanned. It was a bit of a surprise. And I actually felt rather conflicted. As you both may know, that postpartum healing time can last well beyond that 6 weeks that Western medicine kind of puts out there as a norm. And really, what I so often hear from my clients and from friends is it takes years. For me, it usually takes about 2 years to feel like I'm returning to any sense of self, separate from being a mother. And so at that time that I found out I was pregnant again for the second time, I was so tired. I was still so tired and wasn't sure if I was ready to go back into that cycle of gestating, laboring, birthing, breastfeeding another child. And then at the first prenatal visit, an OB I was with, she was new to me. I just initiated care with her. And so this was our first time meeting. And she was doing the ultrasound herself, and her demeanor, I could feel it really shift from lighthearted to a little more focused and concerned to a kind of sad resignation. And then she said to me something that so many people hear: "I'm so sorry, there's no longer a heartbeat."
Mm.
And yeah, and as conflicted or ambivalent as I was about being pregnant, in that moment, I felt this wave. And it's coming back to me as I say it to you now. This wave of grief and sadness. And I folded over in tears, and this doctor was amazing. She showed me what we all deserve, which is a provider who will stand and hold space for you in silence without making you feel rushed or making you feel like an inconvenience. She stood there in silence, and I think she may have had a hand on my back, but if anything, she just stood there and I felt her present and holding space for me. And after a minute or so, she told me she'd give me some time alone before we would talk about possible next steps. She walked out, and then she came in a little bit later, and she was so sensitive in how she talked to me, her tone of voice, her overall demeanor, and we talked about options. So one option was to do a procedure to remove any fetal tissue that was there. Another option was to take medication to induce labor. And another option was to give my body time and see if it would release the pregnancy on its own. And she gave me a few more minutes alone to consider those options, which I am so appreciative of because I feel like there's so often in the stories I hear this rush, this pressure to make decisions right away. And being given that moment to just pause and be with the feelings, and then try to get into a mental space and try to make a decision was very valuable. So when she came back in, I told her I'd like to give my body some time. So we co-created a plan. I'd give myself 2 weeks. And if at the end of those 2 weeks I still hadn't gone into labor, I would self-administer misoprostol. Am I saying that right?
Misoprostol, yeah.
Yeah, misoprostol, vaginally. I would administer it vaginally to induce labor. And that's what ended up happening. 2 weeks passed, and those 2 weeks were really, I know I described this to you both in my intake questionnaire, that that experience of carrying, and I've considered the pregnancy a baby. And I say that because not everyone brings different meaning to their pregnancy and their pregnancy loss. For me, I felt like they were my children, and because I experienced two. But yeah, this first time carrying the pregnancy, carrying my baby, my dead baby in my body was, I say surreal because it's really hard to put into words exactly what I felt. Kind of an, it sounds horrible, but an ickiness, like, oh, I don't want to have this inside me, but also a kind of, I don't know, an appreciation that I still have this physical connection to the pregnancy. Yeah, so I self-administered the misoprostol, and I think what was very surprising was how scared I was to put the pill into my vagina. To know that my dead baby was there and to put my fingers inside that felt very difficult. And so it took me a moment to finally put the pill inside my body. And then the contractions started soon after. And I was laboring. So this is this is something that I try to highlight in my book and in my work, is that oftentimes healthcare providers will tell you that you're going to experience cramping and bleeding when you experience what's commonly referred to as a miscarriage. I refer to as a pregnancy loss because the prefix "mis" means wrongly, or um, like mistake, wrongly or badly. So to me, it feels like there's this blame inherent in the term that doesn't sit well with me, as if I carried the pregnancy wrongly or badly, and therefore I caused it, which so often is not the case. It's out of our control. You'll often be told you're going to experience cramping and bleeding. And what I realized in that moment with my first pregnancy loss was that I was giving birth, that I was laboring. My uterus was contracting to release what was inside it. That's laboring. And then eventually, what was inside my uterus left my body, and that's a birth. And I felt that in that moment, thank goodness I'd given birth already, vaginally and without medication, because this wave of calm came over me at one point that I know how to do, my body knows how to do this because it's done it before. And my heart, after that, after my own personal experience with laboring and birthing a pregnancy loss, my heart really broke for those who've never experienced laboring,
Yeah.
never experienced giving birth vaginally, because I can only imagine the shock and the unease with experiencing all of that. But once that wave of calm washed over me, I felt like I was in that headspace that I was in the first pregnancy and labor, of listening to my body, moving more intuitively. I found myself in the shower, alternating between a fetal position on the shower floor and then on hands and knees, and just letting the warm water console me and comfort me. Yeah, and so that was my first experience with pregnancy loss. And then very soon after, got pregnant again. And that experience was a little different in that I didn't have an early ultrasound. and I found out that I was experiencing a pregnancy loss because of the bleeding that had already begun. And my provider at the time was not as supportive as the first time. My provider was on vacation. It was hard to get a hold of her. And by the time we did touch base, she told me that it's very normal to spot in your first trimester. And what I later realized I needed in that moment was for her to be real, to say it is common for spotting to occur in the first trimester and it could be early signs of a pregnancy loss. Because the whole time intuitively I was like, oh, I think this is a loss. And then to be told repeatedly kind of this over optimism, I don't know how to describe it, but just this constant being told constantly and seeing online like, oh, this is so normal, don't worry, when I think it'd be more helpful to have realistic expectations of what is possible.
Oh my gosh. And I can't, my heart goes out to you for having those sort of back to back as well. So thank you for sharing a lot of these really vulnerable and deep moments. And I think, I'm sure there are women out there listening who have gone through this that can also resonate, that like, and what you just mentioned about how like you realized that actually you were giving birth, because you had to, push what fetus was in there out. And it can't, I'm sure it's so scary for people who have not had birth before. This is their first time doing it. And you're by yourself. There's no one there coaching you. There's no one there to like, walk you through it. And I'm sure that can feel so lonely and scary at the same time. Right?
Oh, absolutely. Absolutely. And as you say that, Jasmine, a memory comes to mind of a friend who was in the throes of her pregnancy loss, laboring, and she texted me, and I was essentially her birth pregnancy loss doula over text. And I asked, can I call you? But that's not what she needed in the moment. She just kept texting me, and I texted her back, just words that my birth doulas had told me in my pregnancies, things that I would have wanted to hear. But overall, you're right that most people who are experiencing loss experience it alone. If it's in the first trimester or early second trimester and they're um, releasing the pregnancy at home, it's basically a home birth. That's a framework I'm offering in the book. If it doesn't resonate with folks, that's okay too. But I offer that as a way to help impart the seriousness of the experience. That it's not just cramping or bleeding, that it can very much be this tremendous threshold that you move through. And if thinking of it as labor, thinking of it as birth helps you to prepare, like you can Google home birth and you could see what are the things that people usually have. You might put like an old sheet over your bed if you're going to be laboring in bed. You can have a toilet hat ready in the toilet if you're birthing or laboring over the toilet. And if what is growing inside your uterus leaves through into the toilet, that hat is there to catch it. If you want to do something, with the remains, these are all things I didn't know. And so I hope, that people listening to this and who read the book come to know something that feels so obvious after the fact. But before you've experienced it or know someone who's gone through it, you don't realize that, you give birth, you labor and you give birth. And I hope that others can feel more prepared mentally, practically, emotionally.
There's something so sacred about the act of giving birth that to dismiss it during a pregnancy loss, for providers to just diminish it to cramping, it feels like you get robbed of this experience of birth. And then if you're not mentally prepared for it, and all of a sudden you're like, oh, I am giving birth. And having some folks feel like their very first experience of giving birth is then in this lens of not being prepared for it. and then overshadowed by like, I'm going through the experience of birth, but I don't get to keep the outcome of the birth. And you think about people who prepare for birth and give birth to a living baby, where it's like, oh, all of that, here's that prize for that hard work and the very primal instincts that kick in and everything. Here is the reward of it. And how sometimes there's also the grief of even the birth process feeling different, especially for a first-time loss who's never had a labor experience before. So I love that you frame it as a home birth, and how do you prepare these folks for, this is going to be a home birth, and what are the things you would have done preparing for home birth. And it does make me sad that the systems are in place, aren't set up to support folks going through this. It's just like, go home and do this, without any preparation mentally, emotionally, physically, of what that's going to entail.
I mean, here's the other thing too, is that I feel like providers say, this is common, this happens. But knowing that this is common and that this happens does not help me if I'm the one going through this right now. Like, I don't feel like that provides very much comfort, knowing that like, oh, this is common, but like, this is sad, this is painful. And what you need probably is not to be dismissed that this is common. You need more preparation mentally, like you're saying, for what's to come. And people miscarry at different times. Like you said, your miscarriages were different, the first versus the second. With your first, you were even able to see some parts that came out, right, when you were, after you put in the medication and you were laboring it out. And so, and some people miscarry and don't even realize that they miscarried, right? And that could be another sad part, is that like, wow, I even like missed that. I missed the chance to even realize that this was what was going on, if you're really early on. So there's wide ranges, I think, of this grief and spectrum of loss, which I think you're doing a really good job of sort of holding space for all of that grief, Eileen.
Yeah, I was going to jump in and say, to your point about that phrase, it's so common, or this is common, being dismissive. I agree. And what I try to do in the book is reframe that. I say, it's a regular part of gestating and like just the fertility journey. Pregnancy loss is actually more common. One of the statistics I came across in my research said, 30 to 40, there's only a 30 to 40% chance of conceiving with any menstrual cycle. A small percentage of that end in live birth. So really, loss is, as much as those of us who endure it feel that we're an anomaly or that something's wrong with us, pregnancy and infant loss is actually more common of an experience. And what I try to do is say in the book that this is a regular part of childbearing, and yet, and knowing that, I hope that readers feel that they're not alone.
Mm-hmm.
So I guess what I'm trying to say is acknowledge that, yes, it's common, but in a way that is meant to be more comforting and normalizing.
Yeah.
I feel like it's hard when people are trying to juggle the both. It's common, but then you feel really alone in it, even though there's like the commonality, because at the end of the day, there's this struggle of, but it's still not fair. Why do the other people get to have their live babies and I don't, even if it's quote unquote common? And so I think there's that wrestling of balancing the normalcy of that, of part of fertility, gestation, and then also this feeling of, but why me? Why don't I get to have a live birth and have my living baby? And it turns into, it becomes grieving, a heavy grieving situation. And I had a conversation with a former labor and delivery nurse friend of mine as I was actually telling her, like, we have this guest coming on the podcast, and I was just sharing her about your story with her. And so we talked about it, her experience. And I always forget that as labor and delivery nurses, it isn't just all sunshine and rainbows giving birth all the time, that they're also dealing with pregnancy and infant loss. And she said a colleague of hers said that she actually recommended that mothers who were losing their babies at birth or pregnancy losses get a chance to see the baby. And the quote was, "It's hard to say goodbye to someone you didn't get to say hello to." So I thought of your story of how when you did labor your first baby loss, that you actually got to see your baby. And you mentioned you wish you took a picture, but you got to see the baby after carrying, and it feels so hard to say dead baby, but you carried your dead baby for 2 weeks and then to finally see the baby. And I know this is a personal decision for most people of like whether or not they want to see the baby. My nurse friend said sometimes if it was just, there was a situation where maybe a baby was so disfigured that she showed the patient the feet, how was it for you? And I think there's like when you saw your baby in your own home, I think you mentioned your partner and your daughter also got to see the baby. What was that like? And would you say the same thing of like it's hard to say goodbye to someone you didn't get to say hello to?
Yeah, as you say that, Peggy, I'm feeling very emotional. I think that resonates for me very much. I think one of you said earlier in the episode something about like this being a loss you can't see. I think that's very apt, a very apt description, that what's growing within us, like folks around us can't see that, especially if it's early on and you don't have a visible bump. And then so often we experience the release of a pregnancy loss privately, and people are not seeing it. So it's no wonder that we feel alone, or that we feel, yeah, like this doesn't happen often because we don't see it. There's no, representation. It's like easily accessible unless you know someone or you're a labor and delivery nurse. Yeah, I was laboring in the shower, as I had mentioned, and I noticed a pretty sizable chunk of fetal tissue had come out. And before it went down the shower drain, I just intuitively grabbed it and I put it in a jar on the counter before returning to the shower. And after I felt done in the shower, I walked out and I looked more closely, and yeah, I could see features. I mean, it was very early on, and yeah, I could still see features. Like, I'll never forget, like the little head, um, a little mouth with what looked like a little tongue kind of sticking out. And the limbs, you could see the limbs. And I just felt awe, like, wow, this was what was inside me. And my husband came into the bathroom to check on me, and I asked him to bring our daughter in. And she was, what, maybe a 1.5 years old, and she was just so curious. And she asked if she could touch it. And I just remember her though, like taking her little finger and like gently touching the head, and how special that was. And we ended up burying the remains in my parents' backyard. And intuitively, I had placed the remains in a box that was made of flour, those papers that are infused with flower seeds. And then I had layered some leaves and rose petals on top, and then I put the remains on it because I wanted our baby to have a soft place to be. Yeah, and then we buried the remains in the backyard. My husband dug the hole, and I think he's a self-proclaimed man of few words, and so I think having something to do, something physical to do, something meaningful to do was a was important for him. So he dug the hole. We placed the remains inside, and our living daughter was with us. And then he covered it, and we buried the remains of the second pregnancy loss in the same area. And you mentioned, Peggy, I wish I had taken a picture I have nothing to look back on except that memory. And I think there's a fear that I'll forget, or I'll forget the details
Yeah.
as I age. With my book, I hope that people will know that they can take pictures, that that's an option,
Yeah.
so they don't have regrets later. And to your point, Peggy, about your friend saying that they encourage families to see the remains, I think it is important to name that as an option for families and to give them choice. Because with pregnancy and infant loss, it can so often feel traumatic. It can feel like they had no choice, even in situations where they may have. Those choices may not have felt like choices. And so to be given opportunities to exercise their choice, to exercise their agency when they couldn't, can be so powerful, so healing. So yeah, so for nurses and other providers to say, would you like to take a photo or a video of the remains or to see them, I think can be really helpful in making this loss more tangible. And when it's more tangible, I feel like that can help in the grieving process. And another option could be for providers to say that or to offer the option of them taking a picture for the family to look at later if they decide, if they're unsure.
Sure. That's a good way to, like, if you're not sure, come back and revisit this, because when you're in the moment, sometimes trying to make a decision, it can be so overwhelming. You're like, I don't know. I don't know what I should decide. What if I make the wrong choice? Or what if I make the wrong decision? It kind of buys them a little bit more time, it sounds like.
Yeah, and I'll add too that there exists these cots called cooling cots, and it can preserve the body of a baby for a little longer. So you might ask if that's an option if you're at a hospital.
Mm-hmm.
Um, if that's an option, that can also buy you some time.
Can I ask, and I may not just have picked up this detail, but how far along were you for your losses? I don't know if you mentioned that earlier.
Yeah, the first one was the first trimester loss. I want to say I found out I had that ultrasound around the 10 or 11 week mark.
Okay.
And then the second was an early second trimester loss around the 13-week mark.
Okay. And then you actually went on and had more living children. So in a way, it's, I want to just not to dismiss your other children that you never got to meet, but to provide the hope that some people are worried that they're never going to see live children again. But that adds a little ray of hope that, like, you can go on and have more. And I also love that, this book, even maybe this podcast episode, it's a way your memory's living on for your children. Like, you're describing them, and that's going to live on. So
Thank
yeah.
you. Yeah,
Mhm.
thank you for that. Yeah, I did have two living children after, and I think the experience of pregnancy, after pregnancy or infant loss can, it's a whole other thing. I knew what a smooth, uncomplicated pregnancy was with my first living child, and I could see the difference. After experiencing loss, being pregnant, there's a lot of anxiety, a lot of fear about it, loss happening again.
Mhm.
And there's a wonderful book called Rebirth. It's all about pregnancy, after pregnancy, and infant loss. So I highly recommend that. And I will say, yes, I hope that that can be a little ray of hope for listeners that you can get pregnant. And I also want to be real in that and say that there is such a thing called recurrent loss, recurrent miscarriage is what it's often called, and unexplained infertility. And a friend is coming to mind who has experienced over 10 pregnancy losses um, within her body and also through surrogacy. And so, you know, as I mentioned in my own story, I would have appreciated my provider telling me at that time that yes, this could be spotting, and it also could be the early stages of pregnancy loss. So same here. I want to say that it is possible to get pregnant again, to have a pregnancy end in living children that continue to live, and it may not. That it may not turn out that way. And there are resources, I think a growing amount of resources for those who continue to experience loss.
What would you say to a mother who's experienced loss and is just terrified about taking that step to try to get pregnant again?
I would say, yeah, that makes a lot of sense. And to take your time, maybe give yourself time to gain the clarity you need about what comes next. It's kind of the short form. Yeah, definitely offer more in the moment.
Yeah.
But yeah, that would be the essence of what I would want to communicate is it's okay not to know. It's okay to feel conflicted and to give yourself time to come to a place of knowing what is right for you.
I'm going to shift gears just slightly and talk about your experience with your living children, the subsequent living children. I know you mentioned that you also experienced some postpartum depression and anxiety following a traumatic birth of your third child. Can you tell our listeners maybe a little bit more and why you think that this third time around was when you developed this? And then maybe share about what did you do to get better?
Yeah, I think the pregnancy was my third living child. So that would have been my fifth pregnancy, right? That was hard for many reasons. We were in the midst of the pandemic with all the variants still kind of coming and going. So unlike the first pregnancy that I described to you both, where I was seeing all these healing practitioners weekly, I saw no one for that pregnancy, with very rare exceptions, because we were doing what we thought was best at that time. The only person I regularly saw was a dear friend, Han. She runs a company in LA called Mother Bees, and she's also the author of the First 40 Days book, one of the first books on postpartum care that really helped bring postpartum traditions to the mainstream here in America. So I had subscribed to food delivery service from her, and she would make the long drive from LA down to where I live every other week. And so I saw her very consistently, and that was medicine for me. But yeah, it was hard that pregnancy because I wasn't getting acupuncture, chiro, massage, like all these things that really helped me bear with all the aches and the pains and to relax and to tend to my mental well-being. And then it was hard because the midwifery practice I was with all of a sudden was closing shop within the weeks that I was supposed to deliver. So that created a lot of internal upheaval that I could feel through the providers. And then my pregnancy went into the 41-week mark. And even though there were some hopeful moments that the labor would begin, it kind of subsided. I ended up birthing in a hospital, and my nurse was amazing, stayed with me beyond the 12-hour shift. And the labor was the labor was as good as it could be for the circumstances. I much prefer laboring in the water, but I chose to have my my water broken to help the labor progress, so I couldn't labor in the water after. But yeah, I was able to move freely. I was able to eat, which wasn't really allowed. But I advocated for myself, and my nurse advocated for me. And yeah, once I gave birth, the baby came out of my body. it felt like an emergency all of a sudden as a number of staff came into the room, rushed into the room rather. The doctor, who was like the on-call doctor, and then at least one other nurse and a few other people. And Dorian, my son, was taken from me. I was told I would get immediate skin-to-skin contact. I went over my birth plan bullet point by bullet point with my nurse, and she said, yes, all of this is standard. But when it came time, my baby was taken to a warming table and wiped down in what felt like a very slow process. And my nurse and my birth doula were both asking that nurse to bring him back. And she didn't listen. She just took her time, seemed very much in her own world. And that was the part that was very traumatizing for me, was that I carried him for 9 months. And why does a stranger get to hold him first? You know? And I think because the nurse was a woman too, that felt like an added layer, because I dedicate my work to women and supporting women, and to have a female, a woman nurse not see me and not hear, my plea to hold my child. Yeah, and I'm tearing up as I say it, because I define trauma in the book as a deep impression that makes it hard to feel safe and at ease, and to retell the story and to still feel all this emotion come up. It left a very deep impression. And to heal, and not to say that healing has an end, like an end moment. I feel like healing can be forever. And yet part of my healing with that particular birth was to reach out to folks, to healing practitioners who I couldn't see during the pregnancy. So I did a virtual call with Tammy Lynn Kent. She's an amazing pelvic bowl physical therapist in Portland. I learned the term womb loss from her work. We did a virtual call and she led me in a guided, like energetic meditation with the womb space. I did what's called birth story listening with Pam England. She created Birthing from Within. And she was amazing. And we talked about that part of the birth that was hard for me. And I think that it goes back to what I capture in the book, which is acknowledgement. Just having yourself and your experience acknowledged can be so powerful. So to have these two healing practitioners hear my story and acknowledge how painful that was to me, it was so helpful. And then the book itself, it emerged from these dining events I was hosting in LA, excuse me, before the pandemic. Because after these experiences, I realized, there's so much in the world about perinatal loss, and most of it focuses on the baby. Much like it happens with living children, right? After these babies come out of our body, the attention so often shifts to them. And I just thought, what about us? Like, it happened to us in our bodies. And so I started hosting these dining events to honor survivors of womb loss, to help them feel seen and heard the way I would have wanted. And then this book came out of a desire to capture those moments so that others could feel what we felt when we gathered to honor ourselves.
Thank you for that. Something really stuck with me when you're talking about this. You said, even as you throughout this recording have feeling these feelings again, and how healing doesn't have an end. And I just want to also recognize that in your sharing of your story of your loss, you are re-grieving, and that grief, every time you have to share the story, it's like you're burying your children again, and that you are there all over again. And I just want to thank you for bringing us into that, because I know that it can be hard. It can be hard to relive those moments of loss again, to almost have to say goodbye to those children again in this space. And I think that's what's so hard about grief. And something else you said earlier too, of like how the first provider didn't rush you through it, and even how your advice is about this kind of the slowing down, or even how you started our episode with a moment of just slowing down, because I think our society is always trying to rush grief and always trying to just be like, okay, just get over it, move on. And even in the decision of having two more living children, how much that doesn't necessarily mean, okay, move on, go on, have more kids. Like continuing in the work that you do and the book, holding that space for this grief that doesn't necessarily have an end. I just wanted to acknowledge that because I think some folks might be going through similar grieving processes, hoping to find some sort of answer of like, how do you make this go away? How do I not feel this way anymore? And changing that narrative of like, it's not necessarily a step to just move on, and that it is this ongoing process, and that even someone whose whole life is dedicated to creating space for people who are grieving will continue to feel this grief and continue to feel that loss, and that that's okay.
It reminds me of something one of our past guests, J.S. Park, said. He says this a lot in his book, and I mean, he's a hospital chaplain, and he always says that grief is not getting over, it's like moving with. So it's not something you can ever really get over. But I think honoring this role that it plays in your life and moving with it through your life, I just love that image of how to hold on to that grief, and that it's okay if you never let it go.
Yeah, I define grief in the book as a response you feel to a loss that is meaningful.
Mm-hmm.
So if you are still feeling any kind of response to a pregnancy or infant loss you've experienced, that's okay, because it was meaningful. So it makes sense
Mm-hmm.
that you feel something about it.
Mm-hmm.
And so I hope that in defining in that way, that people will feel like more okay with feeling about their loss. Yeah, that I think grief, like the grief world and grief literature, I love JS's book because he doesn't do this. But so much in grief, the grief world is about like doing, healing. Like there's this energy about having to do or accomplish or get somewhere. And really, it's about softening. When I was practicing as a therapist, those moments of softening that you witness in your client, and you see like the felt experience like really come through, and it's just that moment of courageous vulnerability. And I think that, yeah, that part of me really is present in the book and wanting to co-create that with the reader, to give them an invitation to allow themselves to soften, because it's in that softening that we can really hear our body's cues. We can really feel the emotions that are there. And when we acknowledge what's there, we can tend to them. The book is called To Tend and to Hold, because what hurts needs tending.
I wanted to ask if you ever felt like perhaps being a person of color, does that change, or how does that maybe impact your ability to give care to other mothers or receive care even?
Oh, what comes to mind immediately was my experiencing birthing my third living child in a hospital setting. This is me coming from a family full of nurses and doctors and pharmacists. Like, we are entrenched in Western medicine.
Mm-hmm.
And still I felt unease about birthing in the hospital as a person of color.
Mm-hmm.
Yeah, I made sure to have, and I did this with all my pregnancies, but I was a little more adamant about having like snacks for the staff,
Mm.
kind of like enticing them with food to take care of me. Um, and yeah, it was hard. It was hard in that situation. I feel like, yeah, there's a lot there that can be said. But to answer the part of your question, as a provider, as a woman of color, I think it's such an advantage because we need more diversity among providers who are supporting pregnant, birthing, and postpartum people, women and people. And I was listening to, was it your first episode for the second season? And um, you were just talking about representation and how important it is to have a podcast and then maybe a media empire that you two will create where we, AAPI women and women, brown women, women of color, of all colors can go and feel like we're going through these issues and we're not alone because we see people who look like us or we hear from people who look like us. And that having yourself mirrored in that very literal way can be so, so healing. Um, the artist who did the artwork for my book, Jo C2 Allen, she's a dear friend. She's Chinese American and she's brown like me. And there was something about creating this book with a woman who's brown, who's Asian, that felt like generational healing. So that's infused into the book. And then I knew before the book came to me in physical form, and like I'm turning back to it now, like I don't know if you could see it, but you see my photo.
Mm-hmm.
And I thought, like, that can be really powerful too, right? For people to pick up the book, to turn to the back and to see a person of color. Because yeah, if you go into the literature for pregnancy and mothering, really there's such a need for racial diversity.
Yeah.
And as it so happens, a friend of mine, her handle on Instagram is Indihe Mama. She came out with a book on postpartum care rooted in Mexican indigenous traditions.
Oh, wow.
It just came out a week ago. It's called Thriving Postpartum for anyone who's interested. But she's a brown woman, and we've had many conversations about racial diversity in the birthing space. And I think that there's this wave, this growing wave that's happening. And that's beautiful and powerful. So, yeah, I think my identity in that way is helpful for those who can relate also and who are searching for representation and to see themselves mirrored back.
When you were talking, I couldn't help but have this feeling of like if our ancestors could see us now, like 3 Asian American Pacific Islander women who are sitting here empowering other women in this space of birth and motherhood and mental health. Like if they could see what we are doing and what we're healing, what they never got or had. Oh my gosh, I'm making everyone cry. I'm so sorry. You guys are making me cry. It just something about when you were saying, talking. It is so powerful. And I was thinking about too, that like we are underrepresented in the space of therapists and doulas. Like you mentioned, like, I know there's like a huge push to get more doulas of color, just historically, when you think about the history of midwifery too. And like, if they could see us and the work, if your ancestors could see you and the work that you're doing, like just, it gives me chills. It gives me chills of like how far we have come as women, of women of color. I don't know, just want to say that.
Yeah, I was tearing up, and then I saw Jasmine tearing up, and I teared up more.
Sorry.
No apologies needed. I very much felt in writing this book the presence of the ancestors and those who experienced womb loss but were blamed, shamed, dismissed. They weren't heard, so to have my voice heard through the book, through this podcast, through the audiobook that I recorded, yeah, it's such a privilege. And you think of all the women of color in the world now who aren't given a second glance. They don't get to use their voice. Yeah, it's a huge privilege, and yeah.
I wanted to ask, because you wear so many hats, like, therapist, doula, yoga teacher, author, mom of 3, so much. Can you tell us a little bit more, like, what your day-to-day is like, or like your brand, right? Our Sacred Women. What is that? What are you offering? I want to hear about it.
Sure, that's a big question. So our Sacred Women was born soon after my first living child was born in 2015. I had this vision for a shirt come to me, and I created that shirt. I don't sell it anymore, but a white shirt that says in bold black colors, "Women are sacred." And this was the time when there was a lot of push for women spaces and women led everything. And so it was in really right timing. And then like just before the pandemic hit, I was feeling really burned out from doing products. I sold the shirt, I sold greeting cards that were affirming of women and mothers, pins, like all these different things. Um, and I just felt really tired because I was also a mother and homeschooling. And I knew I wanted to shift towards more service based offerings. And the pandemic happened, and the idea for the book was really coming to form. And I have focused on this book for the last 4 years. I was supposed to turn the book in a year after selling it to my publisher in 2020, in the fall of 2020. But then I got pregnant in early the following year, and writing about this topic while pregnant was too dissonant.
Mm-hmm.
I really couldn't sink into an embodied place while pregnant. So my publisher was amazing, gave me another year with no questions. And then that following year, I was postpartum. I was acutely postpartum still, and I told him I still can't do it. And I said, that's fine. You have another year. So 4 years in all. And so 4 years in total. I've focused on the book. The book is here. And the book really pulled from all these different parts of my life as a therapist, as a trauma-informed yoga instructor, grief educator. My day to day now is promoting the book, so that's really been all consuming. Instagram, after being off of it for 4 years, I'm having to learn how to use it again. But it's been beautiful to return and to see that my community is still there. Um, I'm homeschooling still one child. Another child is in transition to in-person school. So that's a big shift for us. Um, I know, Peggy, it's you, right, who returned to therapy?
Mm-hmm. Mm-hmm.
Yeah, congratulations.
Thank you.
So that's always been on the table. Um, it's just been hard. It's been hard
Mm-hmm.
to Before the pandemic, I was really looking for a clinical position that would allow me flexibility to be with my child, to breastfeed as much as I still wanted to and all that. But virtual therapy was like pretty non-existent before the pandemic.
Mm-hmm. Yeah.
And the options for private practice were pretty limited. Then the pandemic hit, and I felt like I was all consumed with the book and trying to survive. But that's always been on the table.
Mm-hmm.
So that might be a route I go next. But yeah, my day to day is parenting and doing my best. Like showing up for this podcast took a lot of juggling and planning with my partner, my parents, and the children. And they've been constant sources of support with the childcare, especially whether it's writing the book or now doing interviews, because I need that quiet time and
Mm-hmm.
space to do it. And yeah, so I said it's a big question because it changes every day, but it's a lot of juggling. It's trying to get to bed before midnight. Um, I'm trying to exercise, trying to heal. I have diastasis recti from all the pregnancies and trying to heal that. It's been a whole thing. And all that said, as tiring as it is, as tired as I am, I do feel very lucky. I think, oh, Peggy, you were saying this on the episode that you wanted to do something with your days that felt fulfilling.
Mm-hmm.
And I'm doing, as I listened to that, I was like, I'm doing that. I'm doing good.
Aw.
Like, it's hard. I could cry because how exhausted I am.
Mm-hmm.
And it's fulfilling work.
Mm-hmm.
Yeah, to hold this book in my hand now. And I know it's beginning to take a life of its own as people are getting advanced copies or getting the excerpt for pre-ordering. Yeah, and trusting that it will be carried to who needs it, and that there's a beautiful community like Healing the Tigress, who are there to support me. And yeah, we'll see what comes next.
This is all so exciting to hear about. And it sounds like you have a lot of options of what you can, get yourself into. And it's hard when your kids are young, right? You're juggling a lot of that, it sounds like. But there's some flexibility at least. And this book, like you said, is going to take a life of its own.
Before we wrap up with our usual wrap-up question, where can people find you? What's the best place to connect with you? If people want to connect with you, where can they get the book when it's out?
Yeah, you can find me online at eileensantosrosete.com, and I'll spell that out, EILEENSANTOSROSETE.com. And then on Instagram, I am at Our Sacred Women. Those are the two main places to reach me.
We'll definitely link all of those in the show notes for everyone as well.
Thank you, Peggy.
And what we've been doing this season is just asking folks, a lot of this is about healing our inner tigress, but also how we can, reach back in and heal maybe that inner person or back then. What's one thing you would tell Eileen back then, and kind of in maybe the hardest moments, if you could tell yourself something?
Yeah, I really sat with that question. And what came forward was this: you are not alone. You are not alone. And in the book, actually, that's the closing. There's a closing refrain. Each chapter ends with this: I am here as I am, and so it is. You are here, and we are with you.
I love this common, we had another guest say this was like a cliche thing to say, that you're not alone, but I just feel like you cannot hear that enough. And no matter what you're struggling through, because that's how I felt in the depression, that like I was the only one going through this.
Right.
And so whatever you are struggling with, loss, depression, anxiety, something in your life, I think that's worth remembering, that you are not alone and that there's somebody out there who has walked in similar shoes, who can walk with you. And so, yeah, when you look back and think about this question, it's simple, but it's so true. So true.
Yeah, when you are in the depths of a very primal moment of depression or grief, it's something as simple as that, as knowing that you're not alone. And if I may close with the closing blessing from the book. A closing blessing for the postpartum and bereaved. May you feel seen. May you feel heard. May you feel held. And in times when you do not, may you know that you are deserving of all these things. May you be grounded. May you be slow. May you be gentle. And in times when you are not, may you return to your breath and simply be. May you know your body. May you know a softer way of being. May you know your worth. And in times when that is hard, may you choose yourself over others, even if only for a moment.
Thank you for tuning in to this episode of Healing the Tigress. The more we share these stories, the more we can help other AAPI mothers and partners. If you enjoyed this episode and would like to keep supporting this mission, please hit the subscribe button to the show and take a few seconds to leave a rating. An extra big thanks if you would also leave a review to boost our show visibility and help other AAPI folks find us.
You can also follow us on Instagram at Healing the Tigress, or even better, check out our Patreon at patreon.com/healingthetigress-podcast to support us more. Inside the Patreon, we will be offering more bonus episodes, sneak peeks, and a community for you to help shape our podcast too. Thanks for being here.
Healing the Tigress is produced and edited by Peggy and Jasmine.
Music for this show is remixed by Dr. Tony Huynh of Tony Mixes.
Our intro music is a cover of You and Me by Z Avi, played by our co-host Peggy.
Our outro music is a cover of Green Island Serenade, played by Jasmine's sister.
Cover art design is by Dr. Angela Chung.